Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Our focus tonight is the sharp increase in the number of people with high blood pressure. It has happened in just the last few weeks, and the reason is that there was a change in the definition of what normal blood pressure is. Joining us tonight to talk about this in our weekly Your Health segment is Dr. Michael Miller, Director of the Center for Preventive Cardiology at the University of Maryland Medical Center and author of Heal Your Heart. Doctor, it's good to see you again.
Same here, Jeff. Pleasure.
So let's talk about blood pressure.
Sure.
Why does it matter? What is it and why does it matter?
Well, basically, blood pressure is the force of the beating heart against our blood vessel, our main artery. And that is our top number, our systolic blood pressure. And the bottom number is the pressure between beats. And what we've come to appreciate over the course of a number of years is that the higher the blood pressure over time raises the risk of cardiovascular events, which include stroke, heart attack, kidney disease, kidney failure, and so forth. And so we appreciate in more recent years that lowering blood pressure makes a big difference.
The new number, and it seems a little bit arbitrary because they're round numbers, is 130 over 80, I believe. What does that mean? How's it compared to what it was a few weeks ago?
Right, so a few weeks ago, and for a number of years, blood pressure viewed as high was a top number of at least 140, bottom number of at least 90. But if you go back even longer than that, back when I was a medical student, what we used to do was take the patient's age and then add 100 to that, and that was viewed as acceptable below that number.
So for the top line number.
For the top line number.
Why do we look at two numbers? Because as a shorthand, it's a little bit confusing for people, for non-medical professionals. One number would be a lot better, but it's not sufficient?
Right, and it isn't sufficient because both numbers give us important information. Now, for many years, we used to believe the bottom number was the more important number, and it turns out it is important in younger people. As we get older, our blood vessels may stiffen, and as they stiffen, our top number, systolic, goes up. So now, and over the course of the last decade or so, we've come to realize that the top number becomes more important as we get older. So over the age of 40, top number tends to be more important.
Okay, so I gave the 130 over 80, but there's a much more nuanced version of this, and we have a graphic of it that breaks it into what's normal, elevated, stage 1, stage 2. So you can see this up on the screen. Normal is less than 120 over 80. I thought it was 130. 120?
120 is normal. Yeah, is normal. Let me point out.
Oh, I see.
Yeah.
Elevated is the next one.
Yeah, and what is really normal, so if you go to countries where cardiovascular risk is low, it's not uncommon to see blood pressure in the 100 to 110 range as the top number, systolic. And what we've now appreciate is that for every 20 points above 120, your risk of cardiovascular disease doubles. This is the systolic. So 20 points in the top number or 10 points in the bottom number doubles your risk of heart disease and stroke.
Okay, so the rest of this graphic has stage 1 and stage 2, and then we get to the 130 number I had mentioned, and then a hypertensive crisis, systolic over 180 and diastolic over 120. What does that phrase mean?
Well, that's much more of a concern because of the possible risk of stroke, especially if it's acute. In other words, if somebody normally runs a blood pressure, say, about 120 or so, and then spikes up to 180, that's of great concern. Some people live at high levels, and then they come to the emergency room, they may have a headache, and then their numbers are markedly elevated. So we do need to be concerned as our blood pressures or the patient's blood pressure goes up pretty high.
Let me remind our viewers, if you have a question about blood pressure, how to treat it, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. So there are people out there who never see the doctor. They're walking around, presumably some of them at these very high levels. What could happen to them?
Right. So the big concern, of course, is a stroke. And a stroke, somebody may have known that they have high blood pressure, and they may either have headache, they could have blurriness of vision, they can become weak on one side of their body. So there are a number of different kinds of problems that may occur. So if this if a person has any of these findings, they should contact their doctor or their relative to call the emergency department immediately.
Do they feel it at all? If somebody's walking around, hasn't been to the doctor in 5 years, has no idea what their blood pressure is, and they're up there in 180, 170 or whatever, do they have any sensation of that?
Some do and some don't. It's very interesting because I have patients that have long untreated hypertension. You talk to them, they'll say, yeah, I've had this throbbing headache that I get every once in a while, but I don't pay any attention. Or I take aspirin and so forth. And others, it does come on and it is a problem.
Let's take a phone call. Carroll County, this is Dale. Dale, you're on MPT. Go ahead.
Yes, good evening, gentlemen. I measure my blood pressure twice a day. In the morning, it's quite high, like 150 over 90, and then in the evening, it's 120 over maybe 70 or 110 over 70. Why is that so different from morning to night?
Great question. Thank you, sir.
It is a great question, and blood pressure is highest in the morning. It's highest when we awaken, so that chemicals are released, and it causes our blood vessels to basically constrict. Pulse rate tends to go up. We get up in the morning, so we have a little bit more of the adrenaline release, if you will. So blood pressure does tend to be highest in the morning, lowest in the evening, and even lower when we're sleeping, unless, of course, you're having a bad dream.
We'll talk about the gizmo you brought, but we have a Twitter question. Somebody wants to know, how reliable are the grocery store blood pressure machines? You see the thing outside the pharmacy, you sit down, you stick your arm in the cuff. Can you trust that?
I think the best way to trust it is to know how closely it resembles the blood pressure that you have at your doctor's office. Providing, of course, you don't have a lot of white coat hypertension. We try to take our coats off these days. Or if you're using one of these little digital machines and then try to time it to see how closely they resemble each other.
Okay, so white coat hypertension is a fascinating subject in itself. It's like the placebo effect for the opposite of it, perhaps, for blood pressure. So somebody conceivably has normal blood pressure. They walk into a doctor's office. There's a bunch of people running around with white coats who come over, and they're getting a little bit nervous. They put the cuff on, and it's off the charts. You see that all the time?
All the time, and the fact is, none of us ever check the patient's blood pressure when they walk in. It's usually one of our medical assistants that checks it. But yes, it's because the patient is coming in, is perhaps more aroused, a bit more anxious, and blood pressure could actually spike. To me, that's concerning because it suggests that if they're that anxious during this presentation, perhaps they're more anxious during everyday life at other kinds of scenarios where others may be a little bit more calm. So if the number is about 20 points above where it normally is, I get a little concerned.
What do you do in a visit, and I mean, you do cardiology, but a primary care setting, there's a suspicion of high blood pressure, the machine says it's high. Should they recheck it later in the visit, check the other arm, do it manually instead of auto? I mean, does all that stuff matter?
It does matter, especially if you get numbers that are extremely elevated, much more elevated than had been noted in the past. So what we do is a patient comes in, let's say that's systolic, the top number again, normally is about 120, 130, now it's 160 or so. We will check it before the patient leaves. And it is a good idea also to check both arms of blood pressure, because there could be, on occasion, significant differences, which may mean some medical issues, medical concerns.
Back to the phones, Baltimore County. This is Marie. Marie, thank you for the call. Go ahead.
What does calcification of an artery lead to?
Calcification?
Yes.
Thank you very much.
Yeah, so calcification of an artery is a more advanced stage where you first develop plaque in that artery. Arteries that are calcified may be a little bit more patients could have various readings in their blood pressure that may be a little bit more extreme. And so having calcification both in the major arteries and the coronary arteries can suggest a fair amount of plaque, cholesterol plaque and hardening of the arteries, which may raise the risk of a heart attack.
Okay, the portable unit, which you brought, you see these in the drugstore as well. Show us how it works and who ought to be doing this at home.
Right, so if a person has high blood pressure, they see their physician, and the physician tells them to get readings, they can of course go to their local Rite Aid or grocery store. But this is also a convenient way to do it. You could do this at home using one of these digital monitors. The Omron is quite accurate. It'll cost somewhere between $30 to $80, and simply just open it up, put this over your arm. I'll just demonstrate it. You put it over.
Take off your suit coat.
I would
first.
take my suit coat. Yeah, you definitely want to take your suit coat off and your shirt off, and then you press it in, and then it'll give you a reading over a period of 2 to 3 minutes. Now, what I tell my patients is to discard the first reading. The first reading is often erroneous, or maybe due to anxiety, it tends to be a little bit higher. So here are some of the tips.
Freaked yourself out by
right. So you freak yourself out. Go into a nice, quiet, not very lit room.
Yes.
Relax. Do not talk while you're doing this, because this pressure's going to be about 180 to 200, as you
exactly.
will see.
Yes, we're going to turn up the lights a little hotter.
And so you discard the first reading, then you take the average of the second and the third reading spaced over between 3 to 5 minutes.
All right, this thing's up at, that's the amount of pressure in the cuff. It said 210.
Right.
And
now it's going to go down.
To go grab
it better go down.
Yes, it's gone way down. Let's grab another phone call, then we'll talk about how to improve your blood pressure. Montgomery County, this is Krishna. Thank you for the call. Go ahead.
Yes, sir. I'm an ER physician myself for the last 30 years. Mm-hmm. Whatever I saw so far, you are telling me 140 over 90 is high, and the patient has to rush to the emergency room. And when you are talking about stroke, are you talking about hemorrhagic stroke or ischemic stroke? And is it acute or chronic thing you are talking about?
Thank you very much for the phone call. Stroke.
You can get it. You can get it either way. Super high blood pressure, and generally a systolic well above 200, can cause a hemorrhagic stroke.
Meaning you burst.
Meaning that you
vessel.
burst one of the small blood vessels. But what's more common is somebody who has long-standing hypertension, has small strokes that over time may be or may lead to dementia. And so lots of these little strokes that occur over time that are often more ischemic in nature due to lack of oxygen could also occur in long-standing high blood pressure. It's a little different.
Now, a cynic might think when the medical establishment comes out with new numbers, lowers the numbers to the effect of tens of millions of people suddenly have diagnosable high blood pressure who never had it before, that maybe it's designed to sell some medications. But that's not your first suggestion for how to reduce blood pressure.
And nor is it the committee that wrote these guidelines. The basic premise is with all these guidelines is a good lifestyle. That is always the cornerstone of management, whether it's blood pressure, whether it's glucose for diabetes, whether it's cholesterol. And so we're very cognizant that when we write guidelines is to really make sure that lifestyle is the foundation above which, if medication is needed, then sure, and there are going to be some patients who need medications. But lifestyle is so important because we know that a good lifestyle could take somebody's high blood pressure and bring it back into the normal range.
You've seen that happen?
Absolutely.
What's the recipe for doing that?
Right. So there are several tricks of the trade. Among the most important is weight loss. So if you could get, let's say you have a blood pressure of top number 140, 150, get your weight down somewhere between 5 to 10%, you can drop your blood pressure, your top number, by about 10 points, which is similar to what we see with the blood pressure medication. So weight loss is really important. A second way to do this naturally, if you will, is through diet. There's something called the DASH diet, dietary approaches to stop hypertension. It's a diet that is heavy use of fruits and vegetables, plant-based sources, low in saturated fat and low in animal products. And that could also reduce blood pressure upwards of about 10 points.
I didn't hear you say salt. When you said the word DASH, that made me think salt.
Yes.
And salt used to be the first thing everybody talked about.
And so salt is also part and parcel of this.
Is it still bad? Because I had read some contradictory stuff years ago.
Yeah, people that have hypertension should really restrict their salt intake to less than about 1,500 milligrams of sodium, or about 3/4 of a teaspoon of salt. And so that is, yes, in somebody who has hypertension, absolutely.
Okay.
Absolutely.
Let's grab another call, then we can talk about specific medications. Spivey in Baltimore County, thank you for calling. Go ahead.
Hi, my name is Spivey Conwell, and I'm calling to find out. I had a recent stroke, and it was a transient stroke. Just wondering how I can avoid that in the future, besides the diet, and how serious was it to have that type of a stroke that gave you the symptoms of the dropped face and all that?
Wow. Can I ask how your blood pressure's been?
It's treated, so it's even now, 120/80.
Wow. Okay. Well, it wasn't before.
Oh, it was sky high.
Okay. Well, glad you're doing well. Thanks for the question.
Right. So here's the great news, and again, in Spivey's case, where a stroke has occurred, probably will include a combination of lifestyle and medications to keep things under good control. So from the lifestyle point, we've already discussed some of the ways to do it. Activity. Physical activity will also bring blood pressure down. So walking is a great activity. Walking on the order that we call brisk walking, about 3 to 4 miles an hour, can also have the effect of dropping down blood pressure 5 to 10 points. Potassium-enriched foods. So I like to think of certain foods that are orange, like sweet potatoes and squash, beets and reds. Bananas are also a good source, but there are a lot of other sources. Tomato sauce and beets and celery also lower blood pressure. So there are lots of vegetables.
All right, let's talk about the medications for a minute. I know there's a long list. What are the common drugs and side effects?
Yeah. So the most commonly used drugs include diuretics, so water pills, to get rid of the excess salt in the body. The side effects would include going to the bathroom quite often.
It has to stop at some point.
It has to stop at some point, right. So taking that medication first thing in the morning might help, and try not to take the medication in the evening. There are some of these diuretics, like chlorthalidone, is much longer lasting than hydrochlorothiazide, and so we use that. That's quite a useful drug in our armamentarium of hypertensive patients. There are other medications such as calcium blockers and beta blockers, and a grouping called ACE inhibitors that are all effective in lowering blood pressure, but they do have side effects. No medicine is without side effects, but by and large well tolerated for the majority of individuals.
Some of this stuff over the counter in terms of people thinking about cost of it?
Those medications,
not over the counter. I'm sorry, generic.
Yeah,
right.
All the medicines I've mentioned are all generic now.
Right. Back to the phones, Martinsburg, West Virginia. This is Harold. Harold, thank you for calling. Go ahead.
Yes, I
have been on lisinopril 10 milligrams for about 15 years. I had bypass surgery in 2000. And just recently, I noticed about 2 months ago, when I went to get my prescription refilled at Walmart, I no longer received the lisinopril in a blister pack, I believe is what they call them. And it was a pill much larger than the pill they gave me. Now, the pill they gave me was in a bottle, said 10 milligrams, and it was the same lisinopril, or supposedly, but it's about 1/5 the size of the original pill. Now, I know there's fillers put in them for different reasons, but since then, since I've been on this new prescription, or the new pills, for about 2.5 months now, I've noticed that my blood pressure has been erratic and very high. A couple of weeks ago, it was 200 over 125.
Wow.
But typically, it's up and down. It can be. I just took it a few minutes ago. It was 130 over 84.
Well, that was the calming effect of public television. So, Harold, so it sounds like what you're asking is whether the pharmacy switched up to a pill from a different manufacturer that maybe wasn't exactly comparable.
Well, I know back in this same time frame would have been when they had the fiasco in Puerto Rico, and I know that Puerto Rico made a lot of the drugs that are consumed in this country, but this new bottle, it's lisinopril, 10 milligrams. It all looks the same on the outside.
Harold, thank you for calling. We'll get you an answer on the air. Thanks again.
Thank you. Bye.
Yeah, so the FDA does monitor, as opposed to as opposed to supplements. The FDA is very involved in ensuring that the medications that are prescribed have the actual dose and medication.
Talk to the pharmacist, and
talk to the pharmacist. I would recommend in this particular case, talk to the pharmacist and see if he can get back to the blister pack, because I think they're still available. And
if he spiked a 200 reading on his home gizmo, he probably shouldn't just call us.
He should probably call his physician for sure.
Are there any drugs that commonly people take that cause high blood pressure? Could it be medication induced?
Yes, but that's often for patients that are have received a heart transplant. Okay. So medications like cyclosporin. I will say one thing that can cause hypertension in some individuals is licorice. It contains glyceric acid, which in black licorice can cause blood pressures in some individuals to markedly go up. So you need to be cognizant of that if you have high blood pressure.
Goes with the white coat syndrome, the black licorice.
Matches.
Call from Wycomico County. This is Ben. Ben, thanks for calling. Go ahead.
Yes, sir. My question is, having a high blood pressure, and the doctor said, well, have you had any side effects, being either dizziness or short of breath? And I said, no. Well, you'll be all right. But then the blood pressure, like I say, is like 150 over 95, and took it for like 10 days in a row, and it stayed that way. So my question to you is, they would rather for you to not be on medication to try to reduce it yourself, but isn't that taking you at blood pressure I've been telling you, but isn't that a chance of having a stroke or something like that while you try to reduce the blood pressure without the medication?
Yeah, great question. Thank you very much, Ben. So if you start taking a pill to fix it, it's going to work today.
Right. Yeah, I mean, my advice is always, and depends again what the level of blood pressure is on presentation. So if somebody comes in and they have a really high pressure, let's say well above 150, and we've recommended some dietary changes and lifestyle changes, if we don't bring it down pretty quickly, I'd want to go on medication. Sometimes I'll start medication and lifestyle and have them come back fairly soon.
You were last year about a year ago, and we talked about your book, Heal Your Heart. And the focus of this as a medical doctor was actually on stuff that we all can do fairly easily in terms of diet and stress.
Right. And in fact, the book has the 50 top foods, the best foods that will lower blood pressure, as well as cholesterol and sugar, and glucose, but also ways to relax. So meditation lowers blood pressure. Yoga, my wife loves yoga, it lowers blood pressure. Laughing has a blood pressure lowering effect, not while you're laughing, but after you stop. Listening to your favorite music lowers blood pressure. So there are lots of ways pointing to the aspect of relaxation. You need to relax, because if you don't, especially, the 24/7 that we're exposed to, it could just drive us and our blood pressure way up.
I just have half a minute, but there's a lot of things in the news that are driving people's blood pressure way up. How do you deal with that?
I tell my patients, and I don't watch the news until the last story. So the last minute of the news is the best part.
That's when we do the fun stuff.
That's when you do the fun stuff, and that if anything will lower your blood pressure.
Or sports.
And sports, exactly.
Okay, so bottom line pressure, a lot more people need to be more attentive to their blood pressure.
Exactly.
Very good. Dr. Michael Miller is head of the Center for Preventative Cardiology, University of Maryland Medical Center. Doctor, good to see you.
Same here. Thanks
Thanks very much. Thursday on Your Money and Business, from scanning a city inch by inch to creating prosthetic body parts, we'll go inside the 3D world of digital cloning. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.